Dry herbal dosage for children. When we dose children between the ages of 2 to 12 with dry herbs, we must be mindful of the amount in ounces that we give per child. The physiological process of medicines and also herbs is absorption, distribution, metabolism, and excretion. I will illustrate 3 different types of formulas used in medicine and also in herbs that is used to dose per child doses of dry herbs per ounces. Let's get into it. T-Cell, here to bring you elegant teas. Soothe your stomach with the black tea. Weight loss with green teas. Mellow out with the white tea. Relax and drink your tea. Exfoliate your skin with soft soap. Shea cream to bring that shine. Be clean, drink clean. It is essential to breathe clean. T-Cell, bringing in healthy leaf to a precious body. tcells.com. In this illustration, we'll be using a young male by the name of Herbal, 7 years of age, weight 40.1 kilograms, with a clinical history of muscle dystrophy and lower abdominal pain, with a physician's order of drips of potassium and sodium chloride. Young Herbal wants to substitute their potassium for an herb. So let's go find out what type of herb is good for his clinical history, and furthermore, how much we should give Herbal. So for young Herbal, in order to give the proper dosage, one of the formulas we use likes to have the weight in pounds. According to young Herbal's clinical data that we just reviewed, we were given his weight in kilograms rather than pounds. So now we have to do a weight conversion. We have to change his weight from kilograms to pounds. Now, how do we do that? Well, according to this slide here, we have 2 different conversions. One, if you're giving the pounds and you want to convert it to kilograms, or vice versa, if you have giving the kilograms, such in Herbal's case, and you want to convert it to pounds. So we know that we were giving Herbal's weight as 40.1 kilograms. So we'll simply take that and multiply it times 2.2. 2.2 is a standard number that you will use anytime you're converting from pounds to kilograms or from kilograms to pounds. So when you multiply 40.1 kilograms times 2.2, we're going to get 108 pounds. So Herbal at this time weighs 108 pounds and is 40.1 kilograms. But for this particular illustration, we're going to need the pounds, which is 108 pounds. Now, if you were given the pounds and you want to convert it to kilograms, then you would take the 108 pounds and divide it by 2.2 to give you 40.1. So they're interchangeable. So in this particular example, this is just a medication. This has nothing to do with herbs, but I just want to illustrate more on how you use these conversions. So let's take Lasix, which is a diuretic. In a vial, which is 40 milligrams per 2 mils. So 1 mil equals 20 milligrams in this vial. So the standard of Lasix is 0.5 milligrams per kilograms. And the milligrams is the amount and the kilograms is the weight. So whenever you give a medication or an herb, you want to make sure that the medication or the herb is matching the metrics of the client's weight. So in this case, we're giving the Lasix at 0.5 milligrams per kilograms. So we need to base this amount of dosage on the client's weight in kilograms. So now that we know that young Herbal's pound in weight is 108, we need to get it back to kilograms. And if we look at the example at the top, again, we take the 108 pounds and divide it by 2.2, which gives us 40.1 kilograms. So once we know that his weight in kilograms, which we already have from his clinical database, and we also know from calculating it here in this weight conversion slide. So the 0.5 milligrams per kilograms of Lasix, we're going to multiply that times 40.1, which is his kilograms, which gives us a total of 20.05 milligrams per kilograms of Lasix. And as we noted from the amount of Lasix that are in one vial, the amount that we need to draw up into a syringe and able to administer to young Herbal would be 1 mil, because 1 mil is 20 milligrams, which when we calculated his dosage with his weight in kilograms, we are giving to give him 20.05 milligrams per kilograms. Now let's move on to herbs and the different types of formulas we can use to calculate the appropriate herb dosage for young herbal. So now we're going to get into the three types of formulas that are used for calculating dosage for pediatrics and children between the ages of 2 to 12. As we go through the three that we're going to accomplish here, only really two of them are mainly used in the medical field and in the herb world. The first one here is the Clark's formula, which is my favorite for my personal reasonings. I feel like to me it's more accurate. That it doesn't matter which one you use, and you're going to see the other two in a few minutes here. But this is particular one I use in my health professional career and also with herbs. So, Clark's formula. And Clark's formula, as I stated before in the previous slide when we were doing weight conversions, this is the reason why we had to convert young Herbert's weight from kilograms to pounds, because in this particular formula, they want us to interject pounds rather than kilograms. So in this Clark's formula, which we'll do later with Herbert's information, but for right now, we're just going to learn the basics of Clark's formula, which is your adult dosage, whether it be a medicine or an herb. But in this particular video, we're dealing with herbs in this lesson. So adult dosage of the herb times the weight in pounds divided by 150. Now that 150 is a standard number that is used for all Clark's formula, and it is in the 150 pounds. Normally you might not see the pound abbreviation behind it, but that's what that is. So if we have a particular herb that is adult dosage of 50 milligrams, doesn't matter what kind it is, this is just an example. What we simply going to do first is basic mathematics, basic algebra. We're going to take the pounds, which is 108 of Herbert, divided by the standard number in Clark's formula, which is 150. That gives us 0.34. Now we simply take that and we multiply times the adult dosage of that particular herb, which gives us 17.1 milligrams. So we'll be giving this particular person, this particular herb to Herbert, 17.1 milligrams according to the Clark's formula. Now let's move on to the next formula that we can use. The next formula that we're going to get in is called the Young's formula. Now this formula is also one of the most popular ones aside from the one that we just finished covering, which is Clark's. This one here is different than Clark's because we're not dealing with weight, rather we're using age. And if you look on this slide here, you'll see at Young's formula, again, we're going to use the same herb, the same adult dosage that we used for the last slide, no matter what the herb is at this point. So in order to do Young's formula, whether it's in the medical field or whether it's in the herbal world, we're going to simply take the adult dosage and multiply it times the age in years. And we're also going to take the age in years and add 12 to it. So again, going back to basic algebra, the first thing we're going to do is do everything in parentheses first. And we're going to add the age plus 12. Now again, we're using young Herbert's clinical data that we had that we reviewed earlier. And we know that young Herbert is a male and he's 7 years old. So the first thing we're going to do is take 7, which is his age in years, and add 12. And that simply gives us what? 19. Then we're going to keep everything in parentheses, and we're going to take his age and divide it by the age in years and 12, which is 19. And we're going to get a 0.37. And from that point, we're going to multiply that times the adult dosage, which is 50 milligrams of any particular herb at this point. And we're going to get a total of 18.4 milligrams of herbs. that we're going to give young Herbert according to the Young's formula. So again, the Young's formula is dealing with age, and the Clark's formula is dealing with weight in pounds. And an easy way to kind of remember the Young's formula, if you kind of get confused of whether to use weight or the age, young kind of equals age. When you think of age, you think of young, old. So that's an easy way of kind of remembering the Young's formula. And like I said, Young's formula and Clark's formula are the most popular ones that are used. I like Young's formula, but I use that, but I use mostly the Clark's formula in my healthcare profession and in my herbal world. But it doesn't matter which one you use, just so long you calculate it properly to give to your client or patient. Now let's talk about the third one. So the third and final formula that we're going to be using for herbs, which I'm not going to spend a lot of time on because this particular formula is not used or talked about often, and it's called the Frieds or Fried's formula, however you want to pronounce it. So this one has a similarity to the Clark's formula and also to the Young's formula. The similarity to the Clark's formula is the same way you calculate it. The formula is the same outline, the adult dosage times the age divided by 150. That is the common denominator, the adult age in the 150. As we know in the Clark's formula, is the adult age, the weight in pounds divided by 150 pounds. Okay, this formula here is compatible to the Young's because it's using age, but the difference is this: in the Young's formula, you're using the age in years, whereas in this particular formula, the Fried's formula, you're using it in months. So this comes in good because sometimes you may get clinical data on a particular patient or a client that may be giving the age in months rather than years. So if somebody comes in and say they're 1.7 years old, well, how are you going to implement that into the Young's formula with that 0.7 hanging over your head? How are you going to get that accurate? And I'm so particular about accuracy, which is one of the main reasons why I use the Clark's formula. But again, I'm not saying that the Young's formula is not accurate. It is. But I just feel, for me personally, of the years being in healthcare, that the Clark's formula is my favorite. That's just me. But back to Fried's or Fried's formula. So now we're going to use the age in months. So if you was giving the client information and it's in months, now you can go ahead and use this Fried's or Fried's formula instead of trying to figure out the age and using the Young's formula. And you'll simply do just like you do with the Clark's formula, whereby you will take the adult dosage and you'll simply multiply it. Well, going back to basic algebra again, you do it in parentheses first. So we'll take the age in months divided by 150, which is their standard number we also saw in the Clark's formula. And we will multiply that times the adult dosage. Now you can go back and pause this and use the 50 milligrams for the adult dosage of the herb of your choice. And you can make up an age in months, say 18, and divide it by 150, and you get your amount of how much you would give that particular client or patient in the Fried's or Fried's formula. But again, I don't want to spend too much on this one because it's not seen or used that much. But it is good if you get information based on the age that are placed in months. So here we are at this point where now we're going to fulfill the wishes of young Herbert. We know his clinical history, his weight, his age. We know the different formulas we can use, and we now need to figure out the herb and the amount of that particular herb that young Herbert wants to fulfill, because we know that he was on potassium and he wants to get off, well, not get off the potassium, but he wants to use an herb at home that will have a be a substitute or supplement of potassium within it. So I've decided to use Gojiberry. And now that we have his clinical history and we have 3 different types of formulas we can use, let's get to it. So we're going to use Gojiberry. Now, according to the RDA, which is the recommended dietary allowance, we know that the adult potassium dosage equals to 4,700 milligrams per kilograms, which means 1 ounce of Gojiberry equals 473 milligrams. Now, what that means is 1 ounce of Gojiberry, which is 473 milligrams, is equivalent to an adult dosage of potassium of 4,700 milligrams of kilograms. So that's simply telling me that the adult dosage for Gojiberry is 473 milligrams for potassium. Potassium also has what we call vitamin A, but for this particular client, he's focusing on his potassium, but he will be getting his vitamin A as well. Now, we're going to use this in my favorite formula, as I stated before, which is the Clark's formula. And if you remember the Clark's formula, we take the adult dosage of the herb, we multiply it times the weight in pounds, and we divide it by 150, which is standard. And as I stated, we learned how to convert the weight from kilograms to pounds because we was given young herbis kilograms and pounds, kilograms in weight at 40.1, and we converted it by multiplying it times 2.2 to give us 108 pounds. So let's go through this formula real quick. So the adult dosage for the Gojiberry, as we stated at the top, is 473 milligrams. But in basic general algebra, we know we have to do parentheses first. So let's do the right side of the equation first. So we're going to take the pounds, which we know he weighs 108 pounds, and divide it by 150, which gives us what? 0.73. Then we take that adult dosage of Gojiberry and we multiply times 0.73, which gives us 340 milligrams of Gojiberry. This would be equivalent to the amount of dosage, equivalent to potassium of the amount of dosage we should be giving him according to his particular weight and using the Clark's formula. So the administration of dry Gojiberry herb in ounces would be 340 milligrams of Gojiberry. Now, again, we need to convert that into ounces because we're giving herbs in ounces. So we need to convert milligrams into ounces. So if you have any type of conversion on your computer, you can type in milligrams to ounces. You plug in the numbers and it's going to give you type in 340 milligrams and you hit convert or calculate, and it's going to convert it to ounces, which will give you 0.012 ounces. Now, looking at that, that's like how you're going to measure that particular herb in that little amount. So what we're going to do, which won't hurt, is take that prescribed dosage and we're going to just up it to 0.1 ounces of Gojiberry of dry herb. That's not big of a difference. It won't harm them. If you was to give them 5 ounces, then yeah, you'll be giving too much. But in this case, if you're getting a number like 0.012, let's just round it up to 0.1 ounces of Gojiberry. Don't be too stingy with it. Don't worry about it. It's still an herb. It won't kill them. It's not that big of a difference. You want to be careful if it's kind of getting over 15, maybe 15 to 25% over the original amount, which is 0.012 ounces. So if you get that type of number, then just bring it up to 0.1 and keep it simple. So in saying all of that, doing the calculations according to his clinical history, his wishes, the Clark's formula, we now know, after all of this, after it's all said and done, we know the herb, which is Gojiberry, which is good for potassium. And now we know the prescribed dosage of dry herb of gojiberry that we should be giving young Herbert. So now we're going to write this down on a pad and give it to him, and hopefully he goes and get his gojiberry in daily use of 0.1 ounces of gojiberry in a dry herb. It's his prescribed dose that you've given him. So here we are, finally at the end of this tutorial. Just be careful of the amount of dosage that you're using. First, learn about the herb that you're using, the contradictions. Could it be harmful to a person or a client that may have already have some type of medical issues, or contradictions to some drugs that they may be on already? And just be careful how you calculate the dose. It's your choice of what formula you want to use. The Clark's, Young's, the Freeze, or Fried, however you want to say it. Just be mindful and put the client's interest at best in your hands first, and not prescribe, but let your client know, I am recommending this herb in this amount of dosage, so that they can be happy and hopefully guide themselves to living a more herbal lifestyle. Healing the body, one leaf at a time. T-Cell.